We've had we've had a very full day, and as is always our way, we want to end with reflections about the entire day. So Josh can lead that part. The only thing I'll say at sort of at this moment is that this is a small microcosm of the kind of challenges that we face, and the tendency to see them as technical or within the boundaries of existing roles is very strong. And we heard a few folks comment on even within this little microcosm room, some people looked at the $45 million sort of quasi-discretionary community health improvement as the safest resource that could be repositioned. And the other hospital group looked at their endowment and cordoned off $1 billion. And within a half an hour, two groups looking at very different denominators of resources, it sort of proves that this is an issue of how do you see the problem, how do we frame it, how do we sort of think about the extent to which resources can be used in new ways. And the worst thing is the failure of imagination. If we try to do more of the same, you end up repositioning, sort of recreating the future, which is the one thing that nobody really wants. And that was, this case was kind of built to demonstrate that issue. If you stay within your role, you're going to recreate a future that will absolutely be the worst of all. So to me, that's the most striking thing is that within a few minutes, you can end up having people look at the big game or the small game, and I don't even know that the relative bigger of these two is even big enough. So that was just sort of my quickie observation about the workshop, the exercise itself. But let's step back and do reflections on the full day.